Quite something. Canadians all over the world are being told to come home now. Flights are being cancelled. There's chaos at airports around the world. It's been quite a week. The Prime Minister is in self-isolation. His wife has the coronavirus. Parades, concerts, sports leagues, all cancelled. Schools and daycares are closing. More and more people are working from home. Others are without a paycheck. So just how serious is this? And are we ready?
I think we're probably as prepared as we can be, and more so than most countries, because we've always had such a wonderful healthcare system that there's probably, to me, no other country other than Canada I'd rather be in right now.
A lot of the companies here are making the right move because a lot of people are going to work from home, so that's definitely something that's going to help.
The hospitals are on full alert. I think the government's on full alert. The factor that's going to really dictate what happens in the coming weeks and months is how careful everyone is.
Epidemiologists predict that by April or May, Canada could be like Europe, where tens of thousands are infected. Some say we could even be like Italy, where there are so many sick patients, doctors have to choose who to save. Canada's health minister now says 35 to 70% of Canadians will likely be exposed. That's millions of people. So what can we learn from how other countries are dealing with this outbreak? Are we Italy or are we South Korea? In Italy, hospitals are overwhelmed. Thousands are infected and over 1,400 have died. Contrast that to South Korea. Many thousands are infected there too, but so far, fewer than 100 have died. So what's the difference? A big part is testing. South Korea is testing up to 20,000 people every single day, more per capita than anywhere else. And they have over 50 drive-through testing centers, meaning you don't have to go to the ER or even leave your car to get tested. The U.S. is taking some cues here, opening its own drive-through tests in Walmart parking lots, although it's unclear exactly when those will open. So Canada, well, we reached out to every single province and found a patchwork of plans. But one thing is clear, everyone is ramping up quickly. At least one hospital in Ottawa is experimenting with drive-through tests too, not quite as sophisticated as South Korea perhaps, but still a lot of praise for these efforts. And in Ottawa, they've set up an assessment center and a hockey arena to keep people out of the ER. Other big cities like Toronto, Montreal, Edmonton, and Calgary are doing the same. And some small towns are sending nurses to people's homes to test them. Right now, Ontario tells us it's able to test about 800 people a day, and it's hoping for 5,000 a day by the end of the month. Alberta says it tested 1,000 people in one day this week. So across Canada, over 23,000 people have now been tested. But there's still so much confusion about who is actually eligible for testing, and many stories of people being turned away. Joining me now from Montreal is Mélanie Joly. She's a member of the government's COVID-19 Cabinet Committee. So, Minister, we can get to whether there's enough tests in a moment, but I want to talk to you about chaos at the airports. The government is asking all Canadians to come home, saying there may be new restrictions imposed sooner than expected. I mean, are we looking at a closure of the U.S.-Canada border?
The idea is right now to make sure that we take decisions based on data and while we keep Canadians safe. And we know that across the country, provinces want to make sure that we're flattening that curve and we're keeping things under control and that we're minimizing the number of people that are catching the virus.
Chaos at the airports. There's also chaos here. People with symptoms are saying that they can't get tests. We're now hearing that even with people who don't have symptoms could be carriers. Do we have enough tests to figure out what the actual problem is in this country?
So we were very, very quick to act on this. Earlier this week, we announced $1 billion to support provinces to make sure that they would be able to have enough equipment to deal with this. And the idea is to make sure that we help all our public health officials to have the right equipment, to get the right tests.
There's been a lot of government action in the last few days for sure on this front, but there are also emergency room doctors who are now sending out letters to their colleagues saying, we're going to be like Italy. We can barely handle the cases that we have before there is a pandemic. Are we really ready?
We are ready, but we know that all resources will be put into our healthcare system to go through this. This is an exceptional time. And that's why we as a government are looking at all scenarios, and we're really there to help our healthcare experts, because while there is panic and there is anxiety, we need to make sure that we are guided by science and data and expertise. This is what the SARS epidemic showed us. This is what H1N1 has taught us. And so that's why we're doing this, keeping our calm, our cool, going through this as a government. And you know, at the end of the day, we have a duty of care towards Canadians, and that's exactly the mindset we have while we're going through this.
So are we getting more ventilators somehow? Because that seems to be the issue. And in Italy, they've had to decide who to let live and who to die. The doctors are telling us, public health officials are telling us they don't have enough ventilators.
Well, we were very much aware of what was going on in different countries, because the Minister of Health has been in close contact for weeks now with all the G7 Minister of Health. And we were very attuned with what was going on in Italy and also in China and other countries. And therefore, we decided very quickly to put more money into the system, $1 billion, to make sure that there would not be any equipment missing, and that we would be very well tooled. Now, as you know, we have one of the best universal healthcare system in the world, and we need to make sure that it is really well dealt with while we're going through this.
Minister Joly, it's such a difficult time. Thank you so much for talking to us.
Thank you for your questions. They're needed. Thank you.
Thank you. Joining me now is David Fishman. He is a professor of epidemiology at the University of Toronto, and he did some of that modeling on the virus, predicting between 30 and 70% of Canadians will be exposed. So, David, we'll get to that in just a moment, but we've spoken to so many Canadians, and a lot of them are saying, we've got a great system. Are they, and some have said that the media is overreacting. Are we?
Not overreacting at all, and the media has been a really important ally in this fight, because we need to get the word out, and we need to let people understand the magnitude of the threat we face.
You said just a week ago that you were very afraid. Canadians should be afraid. Should we still be afraid?
We should all be afraid, but we should not let that fear immobilize us. There are simple, straightforward things that we can do as a country to go the route of Hong Kong, Singapore, and Taiwan on this, and not go the route of Italy and France.
Well, what about, should we go as far as China did? You know, there are countries who have managed to lock this down. Is Canada ready for some kind of containment, major containment issue?
Where we need to be going as a country in Canada is preventing those explosive epidemics from happening in the first place. We can do that. The countries that can show us the way on this are Singapore and Hong Kong and Taiwan. Those are countries which we're not talking about because they're quiet. They're quiet not because they're lucky. They're quiet because of aggressive containment and social distancing strategies that they initiated when their outbreaks were small, when their outbreaks were like what we have in Canada right now.
Well, the outbreak so far is fairly small. You think it's going to grow?
In Canada, yes. If you look at the Canadian case numbers week on week, it looks like exponential growth. Our case numbers are an echo of what's happening in other countries around the world, particularly the United States. So we are importing more and more cases in an exponential manner. Each one of those is a spark that can set off a Canadian epidemic, and there is a high level of likelihood that that is going to happen in the coming weeks. Indeed, it may have happened already.
An emergency room doctor in Toronto, one of the big hospitals, sent out a letter this week saying that hospitals in the wealthy industrialized area around Milan cannot offer life support to patients over 65 because they don't have enough ventilators.
Right.
He says that the situation's dire. It's coming here. I mean, are we?
They're trying to warn us. They're trying to warn us. We have one ventilator per 10,000 adults in Ontario. 90% of them are currently occupied. So we effectively have one ventilator per 100,000 adults in Ontario. That drowns in a couple of weeks with an epidemic like this. An epidemic like this lasts a long time. That means there are a lot of people in the situation like they have in Italy who die because we just can't care for them.
So is that what you're saying, that we are going to be like Italy, that we're not like South Korea or Taiwan or any of these countries that have managed to somewhat control the spread?
What I'm saying is we don't have to be like Italy. We have a choice right now. We can act proactively when things are quiet and will be criticized for overreacting, or we can wait until we're in a crisis like Italy and react then, at which point we'll be in a very deep hole that we'll be digging ourselves out of, and people will die predictably.
But what is the solution? It sounds like there aren't enough swabs. There's just not enough tests to go
Right.
around. People are coming back and asking for tests and can't get them.
Right, and that's why we need to move to social distancing now. That's why we need to move to school closure. That's why we need to move to work from home. And that's why we need to move to enforced cancellation of large public gatherings. The threshold that's being used in Quebec is 250. We don't know the exact number, but that's a reasonable jumping off point. We don't have to be perfect. This doesn't have to be martial law, but sooner is better than later. This all works much better if you do it sooner, and it doesn't have to be perfect. At the end of the day, this is not that transmissible a virus. It has a reproduction number of 2. That means each old case makes 1 new case before it gets better. We need to push that to 1. We can do that very simply by having contact numbers in Canadians, having Canadians have half the contact numbers that, now than they did before this epidemic broke out. It's pretty straightforward what the math is. We need to do it. We need to get on it, and the time to get on it is now.
Your message, the Canadian government's message, has changed a lot in the last week. What's your biggest fear right now?
Well, my biggest fear, I was corresponding with a Korean friend about this. We've become good friends because of COVID. He called this for Canada the golden time. This is the golden time. Before our golden time runs out, we need to act. It's the golden time. We don't need to be Italy. We don't need to be France. We don't need to be the UK. This is our golden time to act. And we have to act when things are still quiet so that we are not reacting to a crisis. Proactive, not reactive.
David Fishman, thank you so much for talking to me.
Thank you so much for having me.